Now, as South Korea braces itself for another deadly onset of a flu-related virus, the outbreak of the Middle East Respiratory Syndrome, known as MERS, has already killed 27 people, with more than 170 people in the country said to have been infected. The disease is caused by a coronavirus from the same family as the one that triggered China's deadly 2003 outbreak of Severe Acute Respiratory Syndrome, SARS as it was known then, and it's most likely spread by coughs and sneezes, it's said. There is currently no cure or vaccine that can protect people from the syndrome. Now, joining us from our studio in Pretoria today is World Health Organization representative, Dr. Sarah Louise Barber. Very good morning, Dr. Barber. Thank you for joining us.
Good morning. Thanks for inviting me to join you.
Can you just explain to us MERS, how it spreads, and if we should be worried here on the African continent?
MERS, as you mentioned, is a viral respiratory disease in the family of coronaviruses. Most of the cases to date have actually been spread to healthcare workers, family members, taking care of patients. And so much of the spread to date has been in a healthcare setting or in a home setting where people are providing care to infected patients.
And the spread of the disease, should we be concerned on the African continent that we could have it here soon?
Well, at any one time in the African continent, we have dozens of outbreaks ongoing. The real question is whether these types of outbreaks are significant in terms of their public health implications. We did, as a result of the outbreak in Korea, as you mentioned, it is the largest outbreak of MERS occurring outside of Saudi Arabia, outside of the Middle East. There was a debate and discussion at the WHO. They had an emergency committee that convened that looked again at the MERS coronavirus and determined that this particular disease could be controlled by aggressive disease prevention and control measures, and particularly strong infection prevention and control measures in hospitals, where we saw the largest spread of this particular disease in the Korean outbreak.
Now, we're getting reports that progress is being made with controlling the outbreak in South Korea. Do you agree with that sentiment? And then also, what is the World Health Organization's involvement in the matter?
Yes, the number of cases do appear to be going down. It's not to say that we would not expect to see additional cases, but the government in Korea has taken a very strong approach. They have very quickly mobilized a response into the investigation of all these cases. They've identified cases, identified over 10,000 contacts that are under monitoring for 14 days. The World Health Organization was invited to go to the Republic of Korea to look into this particular outbreak and to try to identify some of the factors that contributed to its spread in South Korea, in the Republic of Korea. And the team went in the beginning of June, and they looked very carefully at this situation. And they determined essentially that there was a single traveler from the Middle East that introduced the disease into the Republic of Korea, that this particular traveler was in hospital, in an emergency room, and there were insufficient infection prevention and control measures in this hospital that essentially allowed the case to spread the disease to healthcare workers, to other patients in the emergency room, as well as family members who were attending to that patient in the hospital. Subsequently, additional cases were reported as a result of that case, and it was spread in a very similar way in the setting of providing health care.
Now, we understand that South Korea started trials of an experimental plasma treatment. Can you tell us a little bit about this, and do you think this kind of thing will be made available to people en masse?
whole blood or plasma from recovered patients is not a new treatment. It's a therapy that has been used before in for certain infectious diseases where we have no vaccines, where we have no treatments. It's been tried, for example, during the Ebola outbreak in West Africa. It was tried for patients that suffered from SARS when we had the outbreak in Asia some years ago. So the concept here is that recovered patients essentially have antibodies, and these antibodies could essentially be given to patients to boost their immune system so that they can, so that their body can essentially fight the invading viruses. So this is essentially a therapy that has been used for some time, and certainly it is now being used again in the Republic of Korea in the hope that this type of therapy can help patients recover more quickly.
In conclusion, at what point do we see travel and if so, trade restrictions coming to effect, and what point do you think that level of concern should be raised?
Well, at present, the only travel restrictions are for cases and contacts, and I think that this is being applied in the Middle East as well as in the Republic of Korea. So cases and their contacts under monitoring are prohibited from traveling. The WHO doesn't recommend any travel restrictions at this stage. And they're asking countries essentially to be on the lookout to step up their surveillance for any severe acute respiratory infections, any patterns of infections that are occurring, any unusual patterns of respiratory infections, any unusual patterns of pneumonia, and to maintain very strong infection prevention control measures in hospitals. And we feel that these basic prevention measures are strong enough, and they have worked in other countries where MERS patients have traveled, and they have been effective in controlling outbreaks in many countries so far. So these measures have been effective, and we think they still will be effective. However, this situation is under constant monitoring.
I thank you for joining us today and putting us into the picture around this virus that's causing quite a bit of consternation. That was Dr. Sarah Louise Barber. She's with the World Health Organization now.